Recently, Bernie Sanders released the latest version of his Medicare for All proposal. So it's very similar to what he previously had, but there are some minor tweaks. And when the story was reported, it actually broke yesterday, there was almost no coverage of what the plan entailed. There was no talk of policy. There was a lot of condescending comments. There were straight news articles that were trying to be passed off as, well, they were referred to as straight news articles, but they were really opinion pieces that were condescending. So I wanted to look at the policy myself, read the policy, and find some of the relevant components of it and share with you. Now, for the purposes of this discussion, I'm gonna talk about what Medicare for All would cover and what it means when it comes to the issue of cost sharing, what it means when it comes to the issue of private insurers. In a later discussion, we'll talk about the different avenues in which this could be paid for, but let me tell you what it says for now. The plan would allow patients to visit doctors with no out-of-pocket fees. The inclusive coverage would only require patients to pay for brand name prescription drugs. Now, Vox reported that. I included the portion that said brand name because that is what the legislation entails. The way that that was written made it seem like Americans would have to pay out of pocket for all prescription drugs, but it does not apply to generic drugs. Here's some more information. His proposal includes a list of financing options, including different ways of taxing the wealthy. So just a quick mention of that because the way that it would be paid for would be through tax increases on the wealthy.
So there's a lot of different articles explaining this, but I also want to focus on the Vox one for a second. So they usually do a very good job of doing explainers, and I want to give Vox credit overall. But in this case, they fall into the same trap that everyone else does. And throughout the article, they keep saying, well, he didn't specify how he's gonna pay for it. No, that's not true. He listed 6, 7 different ways that you're gonna pay for it. They're like, yes, but it's not down to the penny and doesn't explain how much exactly they're gonna get from this, which would be offset by the cost here. Wait a minute, almost no legislation does that. So now, to be fair to Vox, they might have asked similar questions, but almost no one else in the media did, and I didn't track every article that Vox wrote about it. But when it came to the tax cuts for the rich, there's no discussion of like, wait, how are you gonna match those pennies over here? And do all the numbers match up? No, there was no talk of how you're gonna pay for it. They're just like, who cares? Let's just put $1.9 trillion extra on the deficit because it's all going to the rich, so we don't have to justify it. Iraq war, every war we've ever had. Nobody asked, which part of the budget are you getting the money from? What's your estimates? What's the exact numbers? Nobody even bothers to come with 7. They don't come up with one way to pay for it. Bernie in the legislation has all those different ways to pay for it. And nonetheless, half the article is, yeah, but it's not perfectly exact and it doesn't match penny for penny, which almost none other legislation does.
One other thing I want to add is that the legislation or the proposal is 100 pages. It's literally 100 pages, and the very Vox article that you're referring to, Cenk, includes the entire bill, right? So these accusations that this isn't like a well thought out policy is just false. It's very detailed. And so I'm gonna give you some of those details right now, okay? I'm gonna read from the actual bill. Benefits shall, okay, so this is important because if we do get what we want, right? When will the benefits actually kick in? And this is an important thing that I don't think most people are aware of. So benefits shall first be available under this act for items and services furnished on January 1st on the 4th calendar year that begins after the date of enactment of this act, right? So look, I can only guess the reason why that is, but it would probably be because you need to put things in motion and prepare for the actual rollout. Because as we saw with the Affordable Care Act, you enact it, you pass it, and then if you don't really think it through and set everything in motion correctly, you will have a pretty disastrous rollout.
So he's being very careful. Some say Pramila Jayapal's bill in the House is even better. That does it in 2 years, a transition. Of course you need a transition period because you are doing a significant change in this industry, very significant change. Some Democrats say no, it should be like over 20 years.
It's crazy.
Then the Republicans you're not changing it then, that you're never gonna make it. The Republicans are gonna have 1,000 votes to kill it before you get there. And that's part of the reason why those corporate Democrats say that, because they know that. No, 4 years is plenty enough time for a transition, even one as large as this.
Now, there is an exception to that though, and that exception is laid out in the policy. For any eligible individual under the age of 19, benefits shall first be available under this act on January 1st on the first calendar year. So there's an exception there for minors. Now, moving on, beginning on the effective date, it shall be unlawful for a private health insurer to sell health insurance coverage that duplicates the benefits provided under this act, or for an employer to provide the benefits for an employee, former employee, or the dependents of an employee that duplicate the benefits provided under this act. So it's very clear, there is no role for private insurance, and there is no role for an employer to provide private insurance if it duplicates all of the coverage that this Medicare for All plan will provide. And the coverage is extensive, and I have the examples for you.
So that gets to a couple of important issues. So this is when all the media flips out, most of the Democrats flip out, and of course the Republicans hate it. And they go, oh my God, you're gonna get rid of private insurance. But you have to be super clear. Yes, but you replace it with more comprehensive coverage. And Anna's gonna give you some of those details. So you're not losing your doctor. The hospitals are gonna stay exactly where they are. They're not making all of health insurance public. They could, and maybe that would be an interesting option. That's what the UK does, but they're not doing that. It only makes health insurance public, okay? And so instead of private. So it gives you more comprehensive coverage. And second of all, now there's these things that say, no, we should keep private insurance around, like Medicare for America is this new contraption that they came up with. But so what's wrong with keeping private insurance around? But if you keep private insurance and you let them take all the healthy clients, they'll charge them less, that'll give them incentive to take private insurance, and then leave all the sick people to public insurance. Then private insurance goes, see, we're cheaper, we're better. No, it's because you're covering healthier people and you refuse to cover the sick because you know the government will.
It kind of reminds me of what private prisons do, where they'll take low-level offenders that are not very expensive to imprison, and then the state and federal prisons are left with high-level criminals, or felons, I should say, and it's much more expensive to imprison them.
So just lastly on that, guys, if you want to do elective surgery or other like things above and beyond, you can still get private insurance. But keeping the core private insurance for these core health insurance issues is a bad idea because it's a trap. It's a trap meant to make the public option and Medicare for All more expensive and trick people into thinking that private insurance is better when all they're doing is doing self-selection on who they're having as their clients.
Exactly. So some might think, oh, well, if we're dependent on Medicare and that's really the only option, it's a single payer system, what if they don't cover everything that I need? Well, if you look at the bill, it's very comprehensive. It covers everything with the exception of, let's say, elective surgeries like plastic surgery or something like that. So I'm gonna list what this would cover. Bernie's bill would cover hospital services, including inpatient and outpatient hospital care, 24-hour-a-day emergency services, and inpatient prescription drugs. Okay, that's not all, there's a lot. Ambulatory patient services would also be covered. Primary and preventative services, including chronic disease management, would be covered. Prescription drugs, medical devices, biological products, including outpatient prescription drugs, would be covered. Mental health and substance abuse treatment, including inpatient care, would be covered. Laboratory and diagnostic services like blood tests, things like that, would be covered. Comprehensive reproductive, maternity, and newborn care would be covered. Oral health, meaning dental care, audiology, and vision services would also be covered. So dental care, vision care, and also hearing would be covered under this plan. Also, let's take a look at how this plan could change as medical advancements are made. Again, this is a very detailed bill. He considers pretty much everything you could imagine. The secretary shall, on a regular basis, evaluate whether the benefits package should be improved or adjusted to promote the health of beneficiaries, account for changes in medical practice, or new information from medical research, or respond to other relevant developments in health science, and shall make recommendations to Congress regarding any such improvements or adjustments. Now, the one thing that did stand out is but somewhat different from what Bernie has proposed in the past is how prescription drugs would be paid for. So generic drugs are covered under Medicare for all, but what about brand name drugs? Well, there's the cost sharing model. So sharing schedule for prescription drugs and biological products, provided that such schedule is evidence-based and encourages the use of generic drugs, such cost sharing does not apply to preventative drugs. So let me give you the details on that. Such cost sharing does not exceed $200 annually per individual, adjusted annually for inflation. So stop for a second. When it comes to the name brand drugs, even if you have to pay a little out of pocket, it is not to go above $200 a year in out of pocket costs.
That's amazing. So look, let me just summarize here real quick. We get rid of all the stress. No more premiums, no more deductibles, no more worrying about whether you can afford getting yourself treatment or not. You know, people are afraid to take ambulances because it's going to bankrupt them. You can take an ambulance when you want. You can get regular doctor visits. People say, oh, the people are going to go to the doctor too often. Wouldn't that be amazing? We go to the doctor too little now, and it actually costs more in the long run. We could actually go to the dentist without worrying about getting bankrupted. I mean, and the most important part of it is, every other country that does this system costs half of what we pay. So it costs a lot less and gives you all of this. So it's a no-brainer. It's a wonderful policy, and to say that we shouldn't even try for it is outrageous. The TYT Plus app is now available on iOS and Android. Download to get more TYT content at tyt.com/app.